I want to again thank Catherine Thomason and the team of people that put this conference together. I agree with Mona, it's really important. What I want to talk about today is, in a nutshell, why climate change and climate justice matter for social justice. So Jonathan provided a fantastic overview, giving you some more detail on what the recent Lancet Commission on Climate Change and Health said, which is that climate change is potentially catastrophic for human survival. It threatens to undermine the last half century of our gains in development and global health, and it is a medical emergency. But social injustice and health inequities are also an emergency, both globally, where we see huge disparities in wealth and longevity and health, but we see those disparities repeated in every community in the United States, where we find life expectancy differences of up to 15 years in my city of Oakland, in Washington, D.C., in New York, in Milwaukee. These are stark and unacceptable health inequities. So what's the relationship between climate change and health inequities? Well, obviously, where you live impacts what kind of climate risks you're exposed to, but I think from my perspective as a public health physician, the most important contributions to health are our living conditions, the physical, social, economic services, and working environments in which we live, work, and play. And these contribute to inequities through a variety of pathways, but they also increase climate vulnerability. So if you're a farm worker and you're working outdoors, you're more vulnerable to heat. If you're a child and you live in the inner city in an area where there's no trees, no playgrounds, no green space, you're at increased risk from urban heat islands. If you live in a place that already has a lot of air pollution because you live near a freeway or next to a refinery, you're at increased risk from the rising ozone levels associated with warming of the atmosphere. If you're a low-income person and you already suffer from food insecurity, you're at increased risk from the rising food prices that we should expect to see from declining crop yields due to drought, extreme weather, and heat. Climate change takes place against a backdrop of other environmental harms: deforestation, soil degradation, water contamination, ocean dead zones from nitrate fertilizers getting dumped into the oceans, and, as Jonathan talked about, air pollution. And each of those increases our vulnerability to climate change. And most often it is poor, disadvantaged, and disenfranchised communities who suffer most from these other environmental harms. In California now, where we're suffering from incredibly bad smoke plumes all over the state because California is literally burning up, it's the people in the Central Valley who already have the highest rates of asthma and the worst air pollution in the country who are suffering most from the smoke plumes. It is the disenfranchised poor communities in the Central Valley where literally thousands of people have run out of drinking water. They have no water in their taps. They're relying on our public health agencies to provide bottled drinking water and community showers. It's the poor people who don't have health insurance who suffer the most from natural disasters. It's the poor people who don't have transportation who suffer the most when they can't evacuate from Katrina or Superstorm Sandy. And we saw who it was that was left behind in horrible conditions after those events. We know that people with cardiac and respiratory disease and asthma are the people that suffer the most from heat, from air pollution, from other climate impacts. And again, these chronic illnesses are disproportionately a burden in our low-income communities and in people of color. So when we're talking about climate change, we have to think about the climate gap in our response. and this is just an example in California, can see that significantly greater proportions of African American and Latino residents reside in areas that have the highest risks and highest vulnerability for climate change because of their living environments and their pre-existing health conditions. So when we're talking about climate policies, it's our responsibility to really think about what it means, what climate policies and climate change mean for the most disadvantaged among us. When we think about biofuels as an alternative to gasoline, we need to think about what the impacts are on food prices and food insecurity. When we determine that what we want to do in the way of reducing transportation greenhouse gas emissions is to sink a lot of money into electric vehicle rebates as an alternative to active transportation, we need to think about who's getting those rebates. And in California, it is not going to the poorest people that live in our Central Valley. When we think about cap and trade and other market mechanisms, we need to think about what the implications are for allowing persistent high levels of air pollution in environmental justice and fence line communications. We need to think about what transit-oriented development means in terms of gentrification and the impact on affordable housing. These are all important considerations, as is climate change. And when we're talking about Paris, we need to think about what's our responsibility as the nation that's contributed cumulatively a very high proportion of greenhouse gases to providing funding so that lesser developed countries can leapfrog our dirty fossil fuel-based technologies and move into a future that allows them to have electricity, health, power, and transportation for the 21st century without fossil fuels. So another recent Lancet Commission on Planetary Health said, we have been mortgaging the health of future generations to realize economic and development gains in the present. This speaks to another aspect of disproportionate impacts of climate change, and that's climate impacts on future generations. So when we think about climate change and climate justice, we're really talking about global justice, local justice, and intergenerational justice. And what this means is that we have Jonathan really outlined well why we have a professional responsibility to address climate change. What we do makes a difference. We're at the highest levels of CO2 in the last 800,000 years. And we're on a trajectory that's going to blow way past 2 degrees centigrade. We've used up about 2/3 of our total carbon budget to stay within that 2 degree centigrade warming level. And if we don't transform our transportation, energy, and agricultural systems in the next 10, 15, 20 years, there's no way we're going to keep below the 2 degrees. So we have a choice, and as health professionals, we have the opportunity, as Jonathan pointed out, to make changes in policies that will greatly benefit people around the world. This week is the week between the Jewish holidays of Rosh Hashanah and Yom Kippur, the Jewish high holy days. And it's made me look at some of the most ancient Jewish prayers. The Shema is one of the 2 most important Jewish prayers. It's one of the only 2 Jewish prayers that's actually in the Old Testament. And it says that if we let our hearts be lured away and turn astray, the Lord's wrath will close the heavens so that there will be no rain and the earth will not yield its produce. The Quran says something similar. Do not strut arrogantly on the earth. And the Pope's recent encyclical said that our contemporary lifestyle, unsustainable as it is, can only precipitate catastrophes. So in California, where I live, we are seeing those catastrophes with our drought and our wildfires. Many other places around the country are experiencing the same. And I think all of the world's religious leaders are pointing out the fact to us that we need to join with them, because not only do we have a professional responsibility to address this, we have a moral responsibility to address climate change, and we have a personal responsibility to address climate change. Many states are taking very, very significant action to address climate change. The California legislature recently passed a bill that would double energy efficiency and set a goal of 50% renewables by 2030. But the part of the bill that said we'd reduce demand for petroleum use in vehicles by 50% was cut from the bill. And another bill establishing very, very significant targets for deep greenhouse gas emissions failed on the assembly floor. Why? Because the fossil fuels industry became unglued at the idea that California, which is about the 7th or 8th world's largest economy, would actually take very, very significant steps to address climate change. They ran vicious, lying ads on television, specifically targeting African American and Latino voters and their legislators, saying this is a hidden gas tax, saying that these bills would, quote, cost me, a young Latina girl, my college education, saying that we were trying to restrict people's right to use private automobiles. The bill did none of this. The fossil fuels industry is taking its playbook from the tobacco industry. We know what that meant for the health of the public here and around the world. We can't let them do that on climate change. So I really encourage you all to stick around for the lobby day. Go back to your practices, your homes, your communities, and your local and state legislators, and work in concert with the many other sectors and community groups that are working for climate health and climate justice. Thank you.